Coming up on the Doctor's Hospital podcast.
The vagina is a cleansing organ, and so we should be mindful that the vagina has a particular set pH. So if we do things that alter that vaginal ecosystem, then we are going to make ourselves more susceptible to infections.
Doctor's Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6th Terrace, and discover quality, compassionate healthcare at Doctor's Hospital Specialist Clinic.
Welcome to the Doctor's Hospital podcast. I am your host, Alexis Burrows, Marketing Director at Doctor's Hospital. And today I am joined by Dr. Dorita Francis-Phillips, one of our obstetrician and gynecologist here at Doctor's Hospital. Welcome to the podcast.
Thank you.
So today we are going to talk about a very interesting conversation, a very interesting topic, and that's a natural approach to women's health. So this conversation kind of stemmed from, there's been a lot of discussion in online communities, social media, and I imagine amongst women, just even in face-to-face conversation as well, about, taking a more natural approach to feminine hygiene, products that they use, and just generally speaking, kind of in that direction. So we wanted to get you on to kind of talk through some of that, provide some clarity, some context to the conversation, as well as just giving people some medical advice with regards to, generally speaking, how to go about making decisions about using natural products, what types of products to use, what's safe, what's unsafe in that space. Because obviously sometimes these conversations can swing a little too far in one direction, and therefore you kind of throw the baby out with the bathwater, so to speak. So I wanted to give you an opportunity as someone who's in the field, who's very well versed, to kind of just talk our listeners through, what they should consider, and what are some genuine concerns or, not really genuine concerns with regards to this space.
Okay, so good morning. Thank you, Alexis, for having me, and very interesting topic indeed. And so basically, I just wanted to mention that, of course, feminine hygiene products, be it conventional or what we used to call traditional or organic, basically implies any product that a woman may use for her day-to-day care of the female genital area, whether it's the vagina or the vulva. So this can basically be products that they use in terms of cleansing, like soaps, douches, wipes, to the menstrual products, which is basically the one that we tend to look at or talk to more frequently. So in terms of those menstrual products, I'm just giving like a little background just for everyone to understand. So we have those that we can use externally, and we also have those that are used internally. And so, of course, we have some that are disposable and some that are reusable. So in terms of the external ones, this would basically imply all of the menstrual pads or sanitary pads or just sanitary napkins. And so for your internal users, it's the tampons and the menstrual cups. And also, I forgot to mention, for the externals now is the menstrual underwear. So these can be basically broad spectrum of female products, sanitary products. And there's a lot of talks about them, what is safe. Should we be using the old one? Should we move more towards the natural? And so I think it's a good discussion. There are a lot of studies now that we're looking at to look at both the safety and efficacy of these products. And so I'm delighted to get into this discussion with you this morning.
Awesome. So I guess the first thing is, what constitutes or what would make a product natural? Because I think that's a good starting point in terms of you go into the aisle in the food store or in the pharmacy, and you're looking at this array of options. What constitutes it actually being coined a natural product?
Right. So basically, natural means that it's basically made without a lot of synthetic materials, without a lot of derivatives, as we would say in the industry. So naturally, the true natural feminine hygiene products are those products that are made from 100% organic cotton.
Okay.
So we know that cotton is basically grown from trees.
Mm-hmm.
And so these new organic cottons, I should say, or true organic cottons, are basically ones that are made in the absence of things like insecticides
Mm-hmm.
and pesticides,
Mm-hmm.
as we have found that those in themselves can actually produce harmful effects to women. These products are also devoid of things like plastics, dyes.
Mm-hmm.
We also know certain chemicals that are basically harmful or been harmful to the female and their reproductive lifestyle. Um, and another big thing is that in the natural products, these sanitary or hygiene products are basically derived from chlorine and chlorine and plastics and also fragrances.
Mm-hmm.
So you may wonder why those things are important. So basically, if I can mention a bit about the traditionals and then swing
Sure.
back to the organics. So the traditional products were made, yes, using the same cotton and basically cotton and rayon or a mixture of both of those products. And so what tended to have happened was that either they were made using pesticides or insecticides, or during the production itself or purification, these products were actually went through a process of bleaching and therefore introduced chlorine. And so what has been found is that that in itself produced byproducts that have become harmful to um, the reproductive system in most women. And so those are some of the harmful things. Now, in terms of back to the organics, like I said, it's 100% organic cotton derived of these pesticides and
Mm-hmm.
insecticides and basically made from more natural products that have avoided the chlorine. So, like the cellulose comes from basically cellulose wood that was not chlorinated in the process and fragrance free,
Mm-hmm.
which is very important for a lot of women with different conditions.
Okay. Um, so I think you mentioned like plastics and chlorine and things like that. Are there any other common ingredients in conventional products that people might want to avoid? And then I guess what are the concerns with those products? So like you talk about the plastic, the chlorine, and all these other processes. What would be the concern of using those types of products? And I guess why there's been more of a conversation towards natural outside of what might seem obvious to people.
Right. So some of those things may just be just typical chemicals. I mean, to get involved with some of the names like bisphenols, pesticides,
Mm-hmm.
um, things that are involving bleach. Some of those chemicals themselves, what we call synthetic moss, also, that's also an issue. These things can basically promote changes. So they've grouped a lot of these chemicals, polyethylenes, these
Mm-hmm.
ingredients or chemicals for a group of, basically for a broad name, as endocrine disrupting chemicals.
Ah, okay.
So a lot of these products have actually been basically regrouped as endocrine disrupting chemicals. And basically what that does is that these are chemicals that can either mimic hormones in our body. So we know hormones are essential for everyday processes in our body. And so basically the whole female endocrine um, organs
Mhm.
basically secrete hormones ourselves naturally. So imagine that you can have something that you can basically put into your body over a period of time that can either alter or mimic these hormones. And sometimes it can go as far as actually basically destroying the hormones. And
Mhm.
so, because these hormones are essential for a lot of the natural process of a life and menstruation itself, altering menstruation, these have led to basically a lot of alterations in females' reproductive processes, things that are very simple. And so, as we know, menstruation starts basically from puberty and it goes on in a woman's life for a very long time, straight down just to the menopause age. So, imagine that a typical female who is using these products for about an average of 7 days
Mhm.
every month of their life during these major years. And so these are cornerstone years that you are exposed to these chemicals. And so over a period of time, we have noticed that it can alter some of these reproductive processes and lead to some harmful effects that may basically have been hidden. Some of these things we're just finding out about
Hmm.
through new and basically ongoing studies.
Okay. So I mean, I imagine if you think of it very simply, you wouldn't pour bleach in that area. You know what I mean? You wouldn't necessarily want to put something synthetic in that area. And then when you talk about the hormones, yeah, I imagine something that is a disruptor in that way. When you think about it, I think on average you're talking 40, 50 years of life,
Yes.
generally speaking. Yeah, that's a lot. That's a lot of potential damage that can be done. What are the studies showing us in regards to? I know this might be early on. I'm not sure how deep we are into research. Um, but what research has been done, and what are the studies showing with regards to the impact of the traditional space in terms of the ones that aren't taking the natural approach, and how that may be impacting women's reproductive health?
Okay, so everything boils down to toxins,
Hmm.
toxins, toxins, and more toxins. So we have found, or studies, I should say, are looking at the effects of these toxins on reproductive life on a whole.
Hmm.
And so that may mean something simple as the production of hormones, keeping those. So hormones are essential. However, you still need hormones to be within the right quantity, produced at the right time. And just as simple as menstrual cycle is a very delicate process engaging these particular hormones. So some researchers have found that these endocrine disrupting chemicals can actually alter the process simply of menstruation.
Hmm.
It may be one of the factors that is involved in endometriosis,
Hmm.
and it may actually be one that's involved with fertility. So, I mean, those
Hmm.
are two big things. So we're talking about
Definitely.
women with their menstrual health overall, whether or not you may be someone that suffer with menstrual discomforts, as it relates to basically byproducts of these toxins, or basically endometriosis or the conditions. And for most women, or all women, I should think, fertility is one of our main reasons that we're here. We would like to all preserve our fertility desires, whether or not we are willing to engage in childbearing at this point in time, or even for the future, futuristic. So when we're thinking about our teenage girls, we want them to be able to be in a position to make that decision with regards to fertility, and of course to decrease the discomforts that may be centered around the menstrual cycle,
Hmm.
because these things basically interfere with your day-to-day performances at school, at work, social life. So it's a lot. This thing it's evolving, and we want to basically promote good natural reproductive health.
Okay. What do you think are some of the potential health benefits of using natural versus traditional or synthetic products?
Right. So one of the things that I mentioned earlier is that the synthetics tend to have, or basically have, fragrances involved in them. And
Hmm.
these fragrances, a lot of women tend to gravitate towards because you feel as though this is a time where the odor from menstruation may not be something pleasant.
Hmm.
And so these fragrances themselves produce allergens, or they're associated with allergens and sensitivity, so allergic reactions. The vulva and vaginal area is a very sensitive area for female's body.
Hmm.
And so being exposed to these products on a monthly basis can basically promote things like recurrent infections or irritations to that area. So whether it's a vulvitis or recurrent yeast infections, these are some of the things that it can promote. So moving away from these allergens can actually decrease women's recurrences of infections.
Hmm.
There may be a small role to play in terms of the toxins release and discomforts during menstruation. So we're moving away from last menstrual discomforts as well. And basically, the bleaching agents associated with dioxins that are produced from the traditional products. So those can set about harmful effects as well. So that's some of the things that we benefit from overall in moving away from the traditionals.
Right. So, is it possible then, because, it reminds me of a conversation that we were having with another physician and talking about the impact of the environment on your health, right? And we were talking about how people can, like, you have two people work in the same office. The office has mold. One person has an outsized reaction because there's some sensitivity or some allergy to it, and then the other person has no effects. So looking at, the traditional versus natural, is it possible that similarly you have some women that are just either their body is more sensitive, or, there's an allergy that's present that they're unaware of, where they would have more, they would end up having more of an impact from using traditional versus using natural?
Yeah, so sometimes it's just difficult to say, to isolate who will react
Right.
in which way. So that's to do with everything across the medical field. But definitely, we do know that persons that are more prone to allergies
Mm-hmm.
will also be more prone to harmful products that are in the traditional
Right.
products. These natural hygiene products are also, by their way of production and also by the way of disposal, because they're natural, they are more eco-friendly,
Mm-hmm.
so they are better for our environment. So in the long term, this may be something also that is promoted, but definitely persons that have increased sensitivities to common allergens may also react more frequently to the traditional hygiene products.
Mm-hmm.
And persons, even some women, for any reason, with using fragrances that may get what we call, if I may be frank, more bacterial vaginosis, more
Mm-hmm.
yeast infections, may actually benefit from the use of these natural products
Right.
themselves.
Yeah, because, like I said, you may have Grammys who are out there who's like, I used regular products my whole life and there was never an issue. And it might just be that they don't have the sensitivity or they don't have the allergy profile of someone else who may have similarly and been like, well, I had a whole lot of challenges. I'm wondering if this is a part of the problem.
But if I may add on to that, I think that we have to look at different things across the lifespans. So younger women now may come into contact with allergens from different things, pesticides, from even foods.
Mm-hmm.
Whereas our parents
This is
back in
true.
the day may not have come into contact with some of these things, that they're eating may have been more natural,
Mm-hmm.
so they too may have avoided things of that nature. But I'd also like to highlight too that, depending on how old your mom or your grandmothers were, they probably grew up in a time when they used um, strictly cotton reusable hygiene products.
Mm-hmm.
They just had to use more. What do you think happened? We didn't have those Always and Kodaks back
Right.
then, so they were typically using the cotton cloths that were reusable, and so they didn't have to go through some of these processes that made these things a lot more dangerous.
Right. It's like the same way, you go back, our grandparents probably had their kids, our parents, in cloth diapers. It's the same idea. It's like you didn't
Yes,
have these disposable products and that sort of thing in any event. So
yes.
that's an entirely different conversation anyway. All right. So we're having a very good conversation thus far, talking about a natural approach to women's health, natural feminine products with Dr. Dorita Francis-Phillips. We'll take a quick break for words from our sponsors, and then we will be back on the Doctor's Hospital podcast.
Experience the immediate care you deserve at Doctors Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctors Hospital West on Blake Road for immediate, trusted, and best care.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation with Dr. Dorita Francis-Phillips, talking about a natural approach to women's health. So we're going to jump back into, I guess, kind of a conversation about the effectiveness of natural products versus the traditional synthetic ones. So how effective is it? I mean, I imagine people may have concerns like, okay, is it, if it's natural, do I have to use more? Is it going to be as good at preventing odors? Like, because obviously you talked about fragrances in the synthetic ones and that being a part of the process. So generally speaking, how effective are natural products in comparison to traditional?
So the natural products basically are comparable.
Mhm.
Um, they it's not been shown to decrease necessarily any natural odor, or or I should say the reverse,
Mhm.
not associated with an increase in odor or any other issues related to the hygiene during the menstruation
Mhm.
period. But I think what we need to remember is whether it's natural or traditional products based on the size or absorbency or related to an individual's menstrual flow
Mhm.
is important. So it depends on your flow.
Mm.
What typically creates some of the odor associated with menstruation is, of course, the seepage of blood and not changing the products in a timely manner. So some products may be more suitable for women for a light flow. So the menstrual process changes during any menstrual cycle itself. So it may start off for some women as a light day, some may have heavier days in the middle, and then it basically ends on a light day again. So you may want to use products that have variations in sizes, which may be more suitable for that particular time of your flow. And so, avoiding whether or not your flow is heavy or whether or not the pad is full, if you're using a pad, changing them more frequently is the one thing that's basically most effective in controlling that odor itself.
Mhm. So, that's the thing. It's such an individual um process, right? So for some people, we'll call them God's favorites. They have the very normal, natural, which is cycle. You get your 28 days, you get whatever it is, the time frame, it's manageable. And you have people who obviously have, irregular cycles, who may have as compared to what may be normal and a lot more bleeding, things like that. So it is about managing your own process and knowing your own body. And I think that's something, that we've talked about off and on in different conversations as we've done the podcast is know how your body reacts to things. Know
Yes.
how, how much you need, how often you should change your products depending on how your specific flow is, because it is unique in that way, right? There's the standards, like we know that what it should be, but then it's also a lot of variance that exists in out there in the world. And so I think that's as big a part of the conversation as possible, just knowing yourself, knowing
Right.
what you need and how your body operates.
Yeah, absolutely. So I think even in choosing the products,
Hmm.
whether it's a particular brand of the natural products,
Hmm.
it's what works best for you, what makes you more comfortable. Women are usually very self conscious during that time of the month. So you basically want to be confident in knowing that I'm not going to have an accident or a leak. I have chosen the best product for the time within my actual cycle itself. And so I think that one of the things that I would like to stress to women basically would be if you're using, say, for instance, the tampons, or if you're using the menstrual cups, whether it's traditional or the organics, basically pick the time of your cycle that's suitable for the level of that product.
Hmm.
Lower absorbency is always less, has less potential for hazards, but you also want to be mindful of the length of time. If you're using the internal hygiene products, such as the tampons or the menstrual cups, some of them should not exceed the tampons, particularly 4 to 6 hours based
Right.
on your flow. We do know that they have been associated with more risk of toxic shock syndrome, and that is a very serious infection related to Staphylococcus aureus, which is a serious bacterial infection, which comes about basically from overgrowth or lack of air breathing in these
Hmm.
products, and basically the risk associated with them being used or inserted too long for a period of time. And this infection actually can be life-threatening. So that is even more so a reason for us to basically promote hygiene. Just, hygiene, being aware of your body, remembering that you've used it. Sometimes I've actually seen a person who actually inserted one and actually forgot that it was there. So in particular, women in certain professions may be more prone to certain, these risk factors. And I'm thinking in terms of the athletes, your persons that are commonly in the gym, or your swimmers. And so you may have to use these from time to time. And it is what it is. We just have to do what we have to do,
Right.
but be very careful and be very mindful.
Okay. So, when you start to talk about natural products, anybody who goes to the food store and goes through the process of trying to find natural or organic anything knows that there's all kind of variations as to, what the label says and what the label means, and, how natural is natural even when you see that label on a product. So what should women look for in terms of either certifications or labels when they're looking at, feminine hygiene products to ensure that they're actually natural?
Right. So you want to look at whether the product actually really contains 100% natural or organic cotton. So you want to know what it is made up of. If it's the contents are truly organic. Some things are more plant-based. They have more cellulose. So different products basically will promote different aspects of those natural components. But the important thing to look for in your labels would be whether this product has actually been vetted. So is it backed by science? Is it clinically tested? And in terms of whether something is clinically tested, you want to know, has it been tested for humans? Is it safe? Are there any benefits? Okay. And what is the best use of the product? So those will come about by a product that has been clinically tested. And so there are different companies that will actually ensure that these products have been tested clinically and whether or not they have been backed by science. And of course, for most products that are available, particularly in some of our stores, or if you're purchasing on Amazon, then whether or not these products are actually FDA approved.
Right.
So I think once we would have seen some of these labels on the product, then we can kind of have some reassurance. And then you can do your own research. Go on, look at the different the products themselves and research it. These are the days when everyone is Googling. So you can use your Google to your best interest.
For better or worse.
Yes, for your own health and your own safety, by all means.
Let's not take the WebMD too far, though.
No.
All right. So, not to put you on the spot, but are there any specific brands that you're aware of, or products that you're aware of that you believe are trustworthy if a woman wanted to kind of explore using natural products?
I think we see a lot of advertisements with like products like Lumi products. We see Honey Pot, which I tend to, I've read about. They've used a lot of natural products and a lot of plant-based. And it's actually produced and founded by females and Black females at that. But I think definitely one of the products, if I may have a bias, is Women's Haven. And so definitely I'm biased towards it. I know that it has been clinically tested. It's FDA approved, but and the products are all natural, and they basically have a variety of products from tampons, panty liners. They have sanitary pads for all different levels of flow. They even have a menstrual cup, and the most I think important part of that, Women's Haven is actually co-founded by a Bahamian female. Do you know that? Yeah, so definitely. And it is available in most of our stores, in the drug stores and our food stores. I know for certain it's in Solomon's. Yeah, so check out Women's Haven.
Yeah, I've actually seen that. It's interesting, looking in the food stores and the pharmacies, you see a lot more natural products in that space now than you did even going back 2, 3, 4 years ago. So obviously, again, it's why we're having the conversation, because there's been so much discussion and so much exploration in the environment of, is natural the way to go, or is it something to consider, and what are we looking at in terms of that space? So it's very good to hear that we actually have a local Bahamian who co-founded something that is beneficial in this way. All right.
Definitely.
So I guess diving a little bit deeper into that, how has this conversation around feminine hygiene products evolved in recent years, particularly as it pertains to using more natural options?
I think that some of the things that I've encountered in dealing with patients, it basically relates to their the vulva, the vagina, recurrent infections. And so a lot of times this may be the time when, as a gynecologist, we may promote the more natural products. If you're having someone, you've done everything, you've tested, you've treated, it's not something, one of the severe sexually transmitted infections, but it's just an irritation. And this may be one of those times when I actually will really highly recommend that they switch the products. So of course, this may be a big game changer in terms of cost, but these are the persons that I usually will discuss this with. I think one of the things that I'm encountering in practice, basically about feminine hygiene products, it varies according to age. And so some of the younger ones are more interested in the newer things that are out there. Their discussion tends to relate to more to the menstrual cups, or the menstrual pads, the menstrual panties, the menstrual underwear. So a lot of them, we typically have had a discussion about that. I've actually even had a discussion with my own adolescent about the menstrual underwear. And so because these are new things to protect women during this time of the month. And usually, it's guided by their preferences, by their fears, and whatever makes them more comfortable and assertive during this time.
You should see me scratching my head at my own adolescent comment.
Yeah. Oh, yeah. Oh, definitely. I'm there.
Wow. Okay. So are there any misconceptions about natural feminine hygiene products that you want to address?
I think, whereas I can see the benefit of, all natural products, and definitely moving away from things that may harm a woman's reproductive health. I just want to basically highlight that the vagina is a cleansing organ. And so we should be mindful that the vagina has a particular set pH. And so sometimes, even in introducing any product, we don't want to alter that vaginal pH. It's set that way for a reason. The vagina actually has its own type of microorganisms, and basically their existence is important. So I describe it to my young girls as they're like the security guards. So you need them. They basically keep the bad boys out. So if we do things that alter that vaginal ecosystem, then we are going to make ourselves more susceptible to infections and recurrent infections, and no product will help you. So sometimes we have to be careful in going overboard. And so the unnecessary douching or using scented wipes and all these things basically are introducing other things into the vagina, and it changes your whole ecosystem. And that in itself renders you more susceptible to things. So I think that also I'd like to highlight things, we are in an age where women want to be attractive looking, but we have to put things into perspective. So cotton underwear is still the best thing to use. It allows that area to have free airflow. So they're breathable. So you want to wear underwear, or you want to use your hygiene products that allows that good airflow. And so anything that's going to alter that, especially in this kind of climate where it's hot, if we work out a lot, if we exercise a lot, we want to get out of those wet clothes as soon as possible, and we want to change. For those of us that have to use the underwear like thongs, they should also be cotton based. And you may want to pick the time when you use them, and maybe use them for the shortest period of time.
Hmm. Okay. It is interesting. I think, you know, as with a lot of discussions that we've had on the podcast with different physicians, from all kind of different backgrounds and specialties, it's as much about how you take care of your own self as it is anything else.
Most definitely.
So if you're not taking normal and good care of yourself, it almost doesn't matter what you use, right?
Right.
Because if you're delinquent or deficient in any way with your everyday process, you're still gonna have challenges, and that goes as far to, even I think, like you mentioned, your lifestyle habits in terms of your eating, your exercise, all of these different things. All of that kind of has a part to play in it. I think sometimes, we as laymen a lot of times think about things from a very siloed perspective. And so you think about, okay, this is just this one area, not realizing that everything that we do kind of ties into that when you're talking about health, because it's a holistic thing. So how you manage stress, how you eat, how you take care of yourself, all of those things kind of come into play in the conversation. So at the end of the day, while yes, there may be a benefit to using natural products, it's always gonna the conversation is always gonna come back to, how are you taking care of yourself in your everyday life? And that's both from cleanliness to diet to exercise to your mental health and wellness. All of those things have a role to play in the conversation as much as any one single product.
Wait, Alexis, I couldn't have said it any better than that.
I,
Well said, and I agree. I agree with that message.
I think I've been doing this too long now. All right. So thank you very much, Dr. Francis-Phillips, for taking time out of your schedule to join us today. This has been a very good conversation.
Thank you very much for having me.
All right. And to our listeners, again, Dr. Francis-Phillips does work in the doctor's hospital environment. She works out of our clinic at CMC. So if you're interested in booking an appointment with her, it might be difficult. I heard you're booked out. But you can visit clinics.doctorshosp.com, or you can call 302-3250 to book an appointment with Dr. Phillips at our location at Centerville Medical Center. And as always, we invite you to like, comment, subscribe, and share. And we will see you back here next week on the Doctor's Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.